welcome to today's workshop where we're going to be talking about understanding what your lipid panel means from a functional medicine perspective versus the conventional. So on Tuesday, 2 days ago, we did CBC. Yesterday, we did the thyroid, and today we're going to do the lipids. So most of you would have gotten a lipid panel. It's usually every year with your primary care physician, they do get a lipid panel. And if you're wondering what is a lipid panel, it is basically a measurement, right? They take the blood. It's a measurement of your chances or your risk of developing heart disease in the near future. And what we are measuring on the lipid panel is basically two things. It is the cholesterol and it is the triglycerides. Now, you're going to see HDL and LDL as well, but what these are proteins that are attached to cholesterol and triglycerides. So this stands for high density lipoprotein, and LDL stands for low density lipoprotein. So lipid panel is measuring your risk of developing heart disease. We're really measuring just cholesterol and triglycerides. So what exactly is cholesterol? It is a waxy type of substance that is present in actually every cell of our body, and it has a very important role to play in several processes, and we're going to go over a few of them right now. So first of all is the cell membrane. If you joined me on the workshop yesterday, we talked a little bit about how the thyroid hormone, one of the reasons your thyroid might not be working is because the thyroid hormone is actually not getting into, let me see if I'm recording this. Okay, getting into the cell. And I'm just going to show you that picture again. So basically, in this example, and this is true for hormones, this is true for thyroid hormone, for vitamin D, for nutrients, B12, magnesium, all of that. So what that means with the cell membrane is that everything is going well. Your body is producing the hormone, the thyroid, whatever it is, but it's not coming into the cell membrane, into the cell where it needs to do what it's supposed to do. It's because of inflammation that's causing the cell membrane to just be inflamed. So basically, insulin resistance is also very similar, where you have the insulin, you have the vitamin, you have whatever it takes, but it's not getting into the cell because of the inflammation, which there are several things that you can take to improve the integrity of this cell membrane. And one of them is basically good cholesterol in the form of healthy fats and omega-3s, because that helps to improve this so that your vitamins, your minerals, your thyroid can actually get inside the cell and do what it's meant to do. So cholesterol has its importance in the cell membrane integrity. Secondly, I don't know if you know this, but all of our hormones actually start and they come from cholesterol. So I am going to show you, even if you go online and you look at like all the hormones and the pathways, everything, all of our hormones, for example, our adrenal hormones, cortisol, testosterone, progesterone, all of these things start from cholesterol, which is why if you have, I don't like seeing too low cholesterol numbers, especially when people are taking statins, because we need a healthy cholesterol in order to naturally take it through the pathway to make all these hormones. So cholesterol is important because of the cell membrane integrity. It's important for hormone production. It's also important for nutrients and helping form vitamins such as vitamin D. It's crucial for vitamin D. When you get the vitamin D in the sun, you need cholesterol to get it converted in your body so that you can use it. It's also, someone is coming in. Okay. It's also very important for building cells and building tissues. So we need cholesterol. Cholesterol is a good thing. And I don't like it when people say that it's bad and we need to, decrease it. So it's also important in the metabolism in our body. So that is what cholesterol is. Remember, the lipid panel is testing cholesterol and it's testing triglycerides. This is why we need cholesterol. Now, we talked a little bit about HDL and LDL, and the other two markers, those are the other two markers that are usually tested. And I want to just describe briefly what is a lipoprotein. So basically, a lipoprotein is a fatty substrate. It's a protein, and it has to bind with either cholesterol or with triglycerides in order for it to take the cholesterol and triglycerides through the blood vessels in your arteries and put that cholesterol and triglyceride where it needs to go, whether it's the liver, on different cell membranes, or on different organs. So a lipoprotein is basically the cholesterol or the triglyceride attached with the protein, and that becomes what we call a lipoprotein. And again, it allows for transport of the cholesterol and triglycerides in the blood to where it has to go. Let me just, okay. So next up is, there's two types of cholesterols here, as you can see. In addition to the cholesterol with cholesterol and triglycerides, they're measuring HDL and LDL. So HDL is the good cholesterol. That's the one that we always want on the higher end of normal. And LDL is the bad cholesterol. We want to usually lower that. HDL, I want it above 50, 60, 70, 80. That's the numbers that I like to see. And LDL, I like to see below 70, especially if you're diabetic, but definitely below 100. Now, HDL, the high density lipoprotein, which is the good protein that we want elevated. Why is that so? It's good because it absorbs the cholesterol in the blood and the triglycerides, and it takes it in the blood vessel, in the arteries, and it dumps it into the liver, where the liver can then dispose of it or flush it out. So that's why we call HDL good cholesterol. Now, the low density lipoprotein is known as bad cholesterol because that's the cholesterol that gets deposited in your arteries and causes narrowing of your arteries and something called plaque, which then is a cause for heart disease and heart attacks and even strokes. So once again, here is a pictorial version. The bad cholesterol, LDL, is what gets sticky, kind of sticks to the arteries and starts to narrow them out, whereas the good cholesterol takes the triglycerides and the cholesterol and moves it through and takes it to where it needs to go. So we talked about cholesterol, which is the first part of the lipid panel, and now we're talking about the triglycerides. So the triglycerides are basically storage forms of energy, and we need triglycerides. Even though I think on conventional reference ranges it says from 0 to whatever, we need healthy triglycerides in our body. But our number that we like to see is between 70 and 80 milligrams per deciliter. Conventionally, the labs say 0 to 149. Now, even at the Cleveland Clinic here, there's a picture showing that they say there's mild, damage if you have it between 150 to 199. There's moderate damage if your number is 200 to 499, and severe damage to your arteries inside if it's above 500. Again, we are aiming for 70 to 80 milligrams per deciliter. Now, while it is crucial, these triglycerides, we need them in our body. Obviously, elevated levels are going to be increasing the risk of heart disease. And we're going to talk at the end about diet and lifestyle. So, and this is where the numbers slightly differ, but in conventional medicine, they say that total cholesterol should be less than 200 milligrams per deciliter, and the HDL level should be above 60. And LDL levels less than 100. But if you're diabetic, it should be less than, or even pre-diabetic, less than 70. We like the total cholesterol. I'm even okay with it up to 200. There's more studies now that my colleagues have done. 160 to around 200, I'm happy, because again, we need those higher levels of cholesterol to make the hormones and to do all the good things that cholesterol does, which we discussed in the beginning. And HDL should be 55 to 70. I'm fine with 80 as well. And LDL is between 80 and 100. A little bit lower if you're diabetic. We also don't want too low LDL. Same thing, too low LDL can also actually predispose to a lot of bad things. So we want LDL, we want HDL, we want cholesterol, but just within optimal ranges. Now, the test that you normally get has total cholesterol, triglycerides, HDL, and LDL. They may have ratios in there too, like total cholesterol to good cholesterol ratio. But one test that I don't find they do, which we do and we recommend, is called the plaque test. And this it measures the amount of Lp(PLA2), which is an enzyme in the blood, and it can actually assess to see how much of the inflammation in your arteries is due to cholesterol buildup. So we always get this test on every single person who walks through the door. Now that we went through the cholesterol, why it's good, we know why it's bad. And unfortunately, lipid panel is something that you can't tell if it's good or bad unless you just test for it, because the end result is symptomatically is just having a heart attack or a stroke. So these are numbers we should monitor them once a year at least. And I would definitely get an Lp(PLA), the plaque test as well, if you can. So now, the functional approach to managing a lipid profile, how do we increase the HDL and how do we decrease the LDL? We all know the exercise, you got to increase exercise. It helps with every single panel marker. But when it comes to foods, unfortunately, when you have high cholesterol, people get scared and they say, you need a low fat diet. But I am going to argue that you actually need to increase your fats, but you need to increase the right fats. Like we don't want to, so we would want to increase all these things, right? Increase leafy greens, avocados, salmon, fatty fish that you like, different types of almonds and walnuts, berries, some fruits. We also want to increase different seeds such as chia seeds, hemp seeds, flax seeds. So we want to increase the omega-3s and we want to increase healthy fats. We don't want to decrease it. Now we want to try to stay away from, this should be margarine actually. We should decrease the amount of red meat and try to stay away. We know this from the white flours, the white breads, the white pastas. All of this in particular turns into sugar, which causes inflammation. And all of this is intertwined, right? Our body is one. We don't need to just look at the heart. That's a problem with conventional medicine. If you have a heart problem, we send you off to the heart doctor. If you have a gut problem, we send you off to the gastroenterologist. If you have a brain problem, depression, you go to a psychiatrist. So we try to look at the body as a whole, and really everything is interconnected. And we like to look at the root cause of what is going on. So interestingly enough, back in 2004, this was the cover of Time magazine. And it's talking about the secret killer, the surprising link between inflammation and heart attacks, cancer, Alzheimer's, and other diseases, basically chronic diseases, lifestyle diseases, things that we can change. So this has been around. This is 19 years old. And what we know, we need to reduce the inflammation, and that's the name of the game. And it's through our foods, reducing processed foods and inflammatory foods, increasing the good foods, reducing stress and toxic thoughts and negative emotions. All of the things that we've been talking about these last few days is what is going to help with inflammation. Now, getting back to the good fats versus the bad fats, again, these are all things that are going to cause inflammation, and they can be tested. People test this, in the blood when your inflammation markers go up. So I would try to stay away from these types of oils and processed meats. And we should try to increase more of these good fats because it does lower the LDL. And it helps with that cell membrane that I was talking about. So coconut oil is a great fatty oil that we can cook with. And one good thing that you need to know about oils with coconut oil is that you can actually cook on it with very high temperatures. You have to be careful because olive oil is you're not supposed to cook with high heat with this because it makes it rancid. And that becomes toxic. It becomes inflammatory if you cook with olive oil on high heat. So even my Italian friends say that when they make their sauces over hours and hours, it's with medium to low heat. They don't cook with olive oil on high heat. They usually dress their salads or dress their food or cook with medium to low heat. So coconut oil and ghee, which is a clarified butter, are excellent options that have high smoke points so they don't become inflammatory when you cook at high heats. So all of these are just some examples of good fats, and these are some examples of bad fats. The ones that are good, decrease inflammation. The ones that are bad, increase inflammation. And again, the secret killer for pretty much a lot of chronic diseases. Now, I am going to talk to you about the blood work that we offer. We do offer the plaque LPA. For us, for our cardiac panel, we dive deep. We don't just get those 4 markers. We do get the lipids, but then we go into, there's some other lipoproteins that I was talking about that are beyond the scope for this workshop. But we get a whole bunch of apolipoproteins. We get some more here. And this is our basic cardiac panel to give you an idea of if whether or not you are at risk for developing cardiac disease. And we talked on day 1 about CBC, day 2 about our thyroid, and today we talked about the cardiac or the lipid panel, but there's a lot more to it when looking at the cardiac panel. So this is for the females, and for the males, we add in a few more things.